Over the past 2 decades, the United States has seen a devastating surge of substance abuse and addiction, marked by a sharp rise in drug overdose deaths. Opioids, a broad group of pain-relieving medications, are largely to blame because while they offer relief, opioids can be addictive and deadly when misused. You've got prescription opioids like morphine, and then there are illegal ones like heroin and synthetic ones like fentanyl, which are much more powerful. Now, according to the Centers for Disease Control, increased opioid prescriptions led to a first wave of overdose deaths in the 1990s. Heroin use sparked a second wave almost a decade later in 2010. And just a few years after that, in 2013, synthetic opioids like fentanyl fueled another rise. The latest statistics show that manufactured fentanyl, created and distributed through illicit drug markets, are driving a fourth wave. Spectrum News Kentucky reporter David Williams has the story of one mother who lost her son to an overdose.
He was her baby.
Wyatt was a light. I mean, he lit up a room. He just did. No matter who you were, if you needed a friend, he would be that friend.
Touching this pillow helps Julie Hoffmans feel closer to her son, Wyatt Williamson. He was an outdoors kind of guy and the youngest of 3 siblings. This pillow was made from one of his shirts.
But I know in my heart that Wyatt lived a very happy, fun-filled, loved 23 years. So I know he's okay. I know he's with the Lord.
Wyatt's mother tells me his girlfriend was with him one evening, not at this house, and they both took a Xanax pill.
What they think in theory is that Wyatt probably ran out of his prescription. Kids these days, they do crazy things. They give a couple away or whatever, and they think that he ran low, so he probably got it from someone else. But nobody knew that those were, poisoned with fentanyl.
His girlfriend survived. Wyatt died instantly.
I'm not trying to save Wyatt. That can't be done. I'm trying to save others. So I decided to make a Wyatt cabinet. I just thought all things Wyatt.
Wyatt's mother is raising awareness about the deadly dangers of fentanyl. She has spoken to the DEA Family Summit, as well as at Lexington's first annual Opioid Abatement Commission, and recently at the Drug Summit in Harlan County.
If I can save another family from going through what I'm going through, or another child who's lost their sibling, I'm not going to stop at anything.
She has spoken to countless students at 30 different high schools, sharing Wyatt's story. When she's out here with her horse, she's comfortable and feels her son all around. Going to talk to kids in schools helps her feel like her son is still here.
I tell them, Wyatt made a choice on April 5th to take a pill that he did not know where it came from. It did not come from his pharmacy. And that pill took Wyatt's life. In the 3 seconds it takes to take a sip of water and take a pill, Wyatt was gone. And the kids feel that. They feel that pain. They don't want to see their family go through that. They don't want to be gone. And I think it is saving lives.
She wants her son's story in schools nationwide. I'm David Williams, Spectrum News.
Spectrum News national health reporter Erin Billups joins me now with more. And Erin, Wyatt's mom is not alone. Opioids like fentanyl have taken far too many lives. What is it specifically about fentanyl that makes it so much more addictive?
It is extremely potent. It's being manufactured, the stuff that's really causing damage is being manufactured illegally, and these drug makers keep making it stronger and stronger. It's 50 times stronger than heroin, it's 100 times stronger than morphine, and fentanyl has a unique ability it's very efficient at attaching to our natural opioid receptors, which makes it incredibly toxic. It also affects the area of the brain that controls your respiratory system. So that's why people stop breathing when they're using it. So it makes it incredibly dangerous.
Why did we see opioid overdoses spike during the pandemic?
It was just an unfortunately perfect combination of factors, one of which was the market was flooded. The world was distracted by the pandemic, and this illegal drugs started to be flooded into the market and added to many other drugs because it's super cheap. It's potent, and it makes the drug more addictive. So, drug makers added it to all different types of drugs that you wouldn't expect fentanyl to be a part of. And also people were lonely, they were scared, they were facing depression, so much uncertainty, not knowing what's going on in the world. All of that together, there were also supply issues with, your old-fashioned heroin. While fentanyl was being flooded in our, local streets and the illicit drug market.
Well, of course, the priority was to beat back the pandemic at first, but now what has the Biden administration done to address this opioid epidemic?
Well, the Biden administration has been watching this very closely, of course, and they did launch a national strategy for drug control strategy. More than $1 billion, $1.6 billion have been spread out across the states to different programs to try and improve access to recovery services. There is more access to treatment for substance use disorder. They're removing barriers to health interventions like naloxone that became available over the counter. Anyone can buy it and just have it on them just in case. And naloxone can stop an overdose in its tracks. And they're expanding access to recovery support programs and services like a 24-hour or 24/7 opioid treatment program. And the money is also supposed to be geared towards trying to end the drug trafficking, but that's a much harder thing to tackle.
In a couple of locations, they've tried what are called safe injection sites, places where people can, again, understanding that they're going to use these substances, at least get help in the event of an overdose, and also maybe even get connected with services to help them deal with the addiction.
Yeah, and they've shown to actually help reduce the amount of overdose deaths, because what these sites are, they're called harm reduction sites. It's a recognition that people aren't just going to stop using the drugs because you tell them to. It provides a safe place to maybe get needles or to use the drugs in the presence of someone who might be able to help you. It provides strips so you can potentially test your drugs to see if there's fentanyl inside of it. But there are also a lot of people who are against these sites because some people see it as condoning bad behavior. They don't see these sites connecting people to treatment, actively connecting people to treatment, but allowing people to be comfortable in their addiction. So as a result, there isn't access to these sites broadly in the United States. There's inequity there in a sense. You'll see them in cities like New York and Philadelphia, but in more conservative parts of the country, they may not have it. And they kind of work against federal law, which says, you shouldn't have an establishment that allows you to use
they are
illegal
contrary to federal
Yes,
law. In fact,
yeah.
prosecutors have wondered, look, if you come here and you're bringing illegal drugs, how long do you expect us to sit back and watch this before we have to intervene? So it doesn't sound like they've gotten all of the legal
it's not worked out yet.
ideas behind this worked out. Okay, thank you very much, Erin. Thank you for watching our YouTube channel. Let Spectrum News be your resource for balanced, in-depth political coverage, and click the subscribe button right here. You can also download our app or watch us on TV to learn more about the candidates, where they stand on the issues, and more. We'll see you then.